Summit Pacific Medical Center is a special place, and about a year ago, they were faced with a real big surge in volume, so had capacity problems, and then an ERP system change. So changing over every system in the hospital was really the driver of the change necessary for supply chain. Supply chain's execution of the go live and fulfillment was spot on for the conversion, and really what we realized is the rest of the hospital wasn't doing so well. From the MAs to the clinicians, lots of processes that struggled, and because we had done a good job, we really looked inward and said, hey, how can we as a supply chain and a service expand? How can we take some of the burden off of clinical people? How can we insert ourselves into the floors to just help in any way possible? And that drove the expansion of inventory, so we were able to kind of double the amount of locations that we served. The fill rates that we were able to achieve with really data-driven analysis let us push into other areas of the hospital to serve more. And I guess the journey of that helped with the capacity problems. We were able to free up more clinical time for clinical operations and really become a trusted partner of the hospital and push the boundaries of what supply chains asked to do typically. As we kind of brought in the culture of continuous improvement, we started making changes that built upon one another. We were able to do some exciting things as we integrated fully into point of use, and I'm talking, going into the cabinets, filling drawers, filling every spot available for inventory, filling lab fridges, and doing a good job at it, making sure that it didn't run out. We took a step back, and this is a really exciting part. We really looked at our clean supply rooms. Those are the storage, rooms on the units, and said, do we need them? This is square footage. This is square footage in clinical areas that if we just take a few more steps and really adopt the replenishment cart model, push into the point of use areas, we may not need them. And so we tried it. We put an exam bed in one, put in a couple supply carts, and we were actually able to treat patients in some of the former clean rooms. We were able to double the inventory locations. So really, we were at 2,500 bins, spots that we fulfilled, and went to 5,000. The inventory that we controlled, we were able to really double the value of inventory, but also bring the turns from 3 to 6. Some places we brought it up to 8, and really freed up cash flow for the facility. Some of the other impacts, I guess, lab was probably the funnest. Being able to support lab from a data-driven perpetual inventory standpoint was new to them, new to us, and presented some challenges, but really ultimately it drove down their cost probably, right now it's looking about 30%, which has been phenomenal.